From Southeastern Studios, inside their state-of-the-art medical center, the Southeastern Spine Institute proudly presents another edition of the Age of Spinal Medicine. During this medical documentary, your hosts, Vanessa Hill and Angie Mazzell, will be exploring the latest in modern medical procedures, now helping to alleviate most back and neck pain. Using the latest technologies and the vast experience of physicians working together in all areas of spine medicine, the Southeastern Spine Institute can provide you with the best possible treatments, no matter your individual problem.
Couldn't get out of the car, couldn't sit down, would have to stand up just to get relief. So I was in pain. It was not a good time.
Hi, I'm Angie Mazzell.
And I'm Vanessa Hill. Welcome to a special edition of the Age of Spinal Medicine from the Southeastern Spine Institute.
We're coming to you from Southeastern Studios inside the Southeastern Spine Institute, where we've gathered doctors and real patients to tell success stories of getting out of pain, sometimes after suffering for a long time.
Complained of back pain as long as I can remember. I can remember when I went into one of the doctors and they said, well, when did this start? And I really couldn't remember.
The Southeastern Spine Institute created this unique in-house studio in an effort to keep the public updated on the latest technologies and procedures found anywhere in the country.
One of the great things about starting Southeastern Studios is we're able to speak to the public more easily and educate them.
There's new technology coming out every day, and people who years before were told there's nothing that can be done, well, there's a hope for them now. There's an option for them now.
We're so glad you could join us here at Southeastern Studios to learn how this modern medical facility has everything you need under one roof to help you get diagnosed and treated quickly.
So stay tuned and learn from real patients how you can lead a good life after the pain is gone.
Life's good. I enjoy it every day. Every day I get up now, it's a new day, but it comes with a lot of joy. No pain.
Our first story from Southeastern Studios is about a football and a basketball coach who had a lot to learn and teach us about taking care of yourself when you're experiencing back and neck pain. Former Georgetown Mayor Brandon Barber sat down with us to talk about proper back care as you get older and how you can still enjoy a pain-free life. You just need to be careful.
Talk about no pain, no gain. No. If you feel pain, something's wrong, so stop.
But if you're experiencing pain that won't go away, that's a signal. It's important to get it checked out before it gets worse.
Numbing or pain in your arms, hands, legs, feet, we need to have you come in right away so we can evaluate you to ensure that there's no permanent nerve damage being done.
After years of playing football and leading a very active life, Brandon started to experience a lot of discomfort, not just in his back, but in his legs and feet as well.
The pain was in my lower back, but then it also went all the way down the left side of my leg. It seemed like it was even in my toes.
Even after changing his daily activities, the pain just didn't go away on its own.
Couldn't get out of the car, couldn't sit down, would have to stand up just to get relief. So I was in pain. It was not a good time.
So Brandon knew he would need to go to the best place to help with his problem.
I wanted relief, but I wanted the best, so let me check on these guys, and I found out these guys were, well known throughout the country.
With many different doctors working in all areas of the spine, Brandon felt comfortable that Southeastern Spine could pinpoint his pain issue and would give him the best treatment for his specific problem.
We have so many different subspecialties, we were able to direct Brandon to the doctors that could help him treat his problem without surgery.
There are multiple different injections and procedures available for patients with chronic and acute back pain.
What he told me, he said, look, let's try the injections first, and then let's see how that works.
Another subspecialty to help avoid surgery is advanced physical therapy. In the PT department at the Southeastern Spine Institute, they have professionals that focus only on the spine, recognizing that everyone's issue is unique and requires specialized treatments.
So our physical therapy is exceptional here because of our one-on-one patient approach coupled with evidence-based spinal knowledge. Helps us customize our treatments to best help your specific problem.
Over time, epidural shots coupled with physical therapy helped Brandon get better and get back to his active life. But that's not the end of the story. Brandon learned that he had to continue to take care of his back and adjust his lifestyle as he got older.
Just staying active at this point and not try to work out or condition yourself like you're going to play a football game or a basketball game. That's beyond these years.
Well, Angie, we've learned that it's important to change the way we do some of the things in our lives.
That's right. But as Brandon mentioned, if you've done all you can and you've made those lifestyle changes and you continue to have pain, that's the time to seek professional help.
When we come back, you'll meet a woman who has tried many things, but nothing helped. And she just got worse and worse.
I wasn't getting any better. I was getting worse. And the pain was so intense that when they would ask me, what was your pain level, it was a 15. It was a continuous cramping muscle spasm that was severe, and it never stopped.
When the numbing pain and continued weakness in Kathy Diarborn's leg just wouldn't go away, she went to a local hospital to have it checked out.
They diagnosed me with L5, and then they gave me shots, and they had looked at the MRI and said there should be no reason for this much pain. All of a sudden my life changed and I was bedridden.
Kathy's husband, Mark, had to help her do nearly everything, and the pain was keeping her almost totally disabled. And as you might know, it is hard to watch a loved one suffering so.
You know, to see my wife not able to walk and pretty much, crying and passing out in pain, it was tough. I mean, it'd be tough for anybody that cared about their partner.
So Kathy called the Southeastern Spine Institute and was able to make her own appointment to see Dr. Stephen Paletti, hoping he would be able to find a solution to her problem.
He said, let me look at the MRI along with my colleagues and I'll get back with you.
The Southeastern Spine Institute has 2 new state-of-the-art wide-bore MRI. These modern MRIs allow the patient to go into the unit feet first and are much larger, so it can help those who might feel claustrophobic. And with the latest technology in reading and evaluating imaging, our doctors can have a more accurate diagnosis when they sit down to create the best medical plan for fixing their patient's specific problem.
This is a picture, and the clearer the picture, the more sure you are of the diagnosis.
And one of the first things I do is say, let's get a new MRI with a clearer picture, finer cuts, and we can get a more accurate read of what's going on. And then you compare that to their old MRI, things can get missed.
I mean, I don't know anything about MRIs, but I could look at the quality and see that every single thing was showing. He did the MRI, we went back into his room, and he said, I can fix this.
Kathy's situation for us was straightforward. She had a fragment of disc pressing into a nerve and had to have surgery.
Kathy now had a definitive answer to what was causing her excruciating pain. But the good news was that the surgery needed to correct the structural problem in her spine could be done utilizing the latest technologies and procedures found anywhere in the country.
And I woke up from my surgery, and the nurse asked me what my pain level was, and it was a 2. It had gone from a 15 to a 2. It was just a miracle.
After suffering for so long, Kathy was now out of pain and back to her active life, and that includes now being able to sit and discover her newfound love of painting.
I couldn't sit for any length of time, and I had just started art lessons, and I was so excited about them. So just to be able to sit here is a blessing.
When Kathy's husband, Mark, started having back issues of his own, he knew where to go first. As for over 90% of Southeastern Spine patients, Mark found relief without surgery.
Mission accomplished.
All he needed was a series of shots to get back to life, and he couldn't be happier.
we're really happy now that we can ride our bikes. And we've got a second shot at things, which is always good.
It's such a nice story to see people who are once in pain get back to their life again, and here everything's under one roof so you can get help regardless of your specific problem.
That's right. Everyone's issue is different. That's why the Southeastern Spine Institute has many different doctors to handle all of the spinal issues. And that's why Kathy provides some additional advice for those suffering with neck or back pain.
Well, I tell them, don't do what I did and wait. Always get a second opinion if you're not comfortable. But if you go to Southeastern Spine in the first place, you probably won't have any issues.
Well, I think that we've learned that no matter what type of neck or back problem we're experiencing, the first thing that we should do is go to a place that specializes in the spine.
That's right, and you'll see in our next story from Southeastern Studios, patient George Conbeer said it's very important to educate yourself on what to expect before you come to the Southeastern Spine Institute.
One of the things that I found when I looked at Southeastern Spine and the information is available was the large percentage of patients that get better without having to have surgery.
We're here again at Southeastern Studios. The Southeastern Spine Institute created this space to bring you the latest information on spine health. Dr. Thomas Anderson explains.
We feel like we should do our part in offering that information and educating patients so that they get the best possible information.
George Conbeer experienced back pain for as long as he could remember, and he was doing the best he could to keep the pain at bay, until one day, tragedy struck.
Because I'd pretty much been able to manage the pain prior to that with exercise and NSAIDs, but that episode really kind of made me an invalid.
Even if you've been managing your chronic pain, something as simple as a golf swing can have life-changing and devastating consequences.
Took a big swing and excruciating pain just shot through my body. It was like a lightning bolt coming from the top of my head all the way down to my feet.
Yeah, it certainly can, in some cases, can hit you unexpectedly and with a severity that is really incapacitating.
George had been seeing doctors for his chronic problem, but when the pain suddenly became debilitating, he didn't like what he was being told was the best course of action.
All the physicians that I saw pretty much diagnosed the same thing. Wanted to do a laminectomy and a fusion. And in one case it was a fusion with a cage and a bunch of screws. In another case it was some kind of clip thing.
George knew he needed another option, and he decided to go see a specialist at the Southeastern Spine Institute. So he made his own appointment to see surgeon Thomas Anderson.
When I went to see Anderson, his take on it was a little different. He did not think that a fusion was merited.
I always try to treat people conservatively, but the sooner we get a diagnosis, the sooner we can do the right thing.
Not only does Southeastern Spine have doctors in multiple disciplines, if surgery is required, they also have many different types of surgeons to help decide the best way to proceed.
We're able to look at the surgical approach from a variety of different angles to try to figure out what will be the most effective approach, ideally the least invasive.
To help create the highest chance of a successful surgery, Southeastern Spine performs minimally invasive or microsurgery. These modern surgeries have shorter recovery times, better outcomes, and can be done at Southeastern Spine's own same-day surgery center.
Having this surgery and having the results that I've had changed everything. Was able to play golf again. I just got back from a week up in Michigan sledding with my grandchildren. I took the kids and got on this big inner tube and they climbed on top of me and we rolled down this hill and we hit bumps and the thing was flying all over the place and we were laughing like little babies. I mean, it was a really good time. It changed my life.
I'm sure many of you're seeing these stories and you're thinking, maybe I can get my life back too, but there's that fear of taking that first step to come in. That's actually very common.
Right, well, alleviating the fear. That's why we're here, bringing the information in the Southeastern Studios, and why even doctors at the Southeastern Spine Institute understand your concerns.
And it can be intimidating to come to a doctor, certainly to see a surgeon. I respect that as just being a human being who's seen doctors and having anxiety about that myself. But you know, when you're coming here, literally all we're doing is having a conversation. We're talking, we're just trying to figure out the problem.
Some of you from out of town might be concerned about making that drive all the way to Mount Pleasant, but as Rich Matera says, it was worth making that drive from Sun City to make sure that he was treated by the best.
I wasn't convinced that working on my back locally was the right thing to do, simply because they weren't top of the field.
Taking care of his back problem was so important for this very active 71-year-old competitive softball player, and he didn't like what he heard from a local doctor.
So I did try to go to a practice in Savannah, and they took some x-rays and they heard that I played shortstop in our league. And immediately they said, well, don't plan on playing shortstop, you better start adapting to first base. You know, so I got rid of that guy.
After non-operative treatments stopped working for him, Rich and his wife Candy made the 2-hour drive to Southeastern Spine to speak with surgeon Timothy Bryan to talk about a better solution.
Met Dr. Bryan, he took MRIs and consultation was done, and you know, it sounded good.
Once I met him, he was very calming. Everybody there seemed so nice. They explained everything, even in terms that I could understand, and I felt very confident.
Went over his x-rays and MRI, talked about how bad his pressure was. And you see you got a little wear and tear at the 2 lower discs down here. And he'd seen kind of a progressive decline in his abilities. And he'd tried a lot of other non-operative procedures and they hadn't worked. So we talked about surgery.
Rich is very active in his retirement, but it was his love of softball that made him want to do whatever it might take, including surgery, to get back on the field. Candy could see how important it was to his happiness.
He was going into kind of a depression with it. This is what he loves to do. This is his passion.
Getting Rich back to playing the very demanding position of shortstop was going to take advanced surgical techniques. We asked Dr. Bryan if using all of these new procedures makes him a better doctor.
I think it does make you a better doctor. I think you're performing surgery in a more minimally invasive fashion with smaller incisions and robotics, and intraoperative imaging helps achieve those goals.
The team approach to Southeastern Spine made Candy more comfortable about Rich having surgery, and they were both pleasantly surprised with the outcome.
The flexibility has returned, as well as being able to do some of the things that I wanted to do before and couldn't do, but now I'm able to do.
Such a world of good to see him smiling so big again.
Rich is now back to living a full life in retirement. And he's so glad he made the short trip to Charleston to get treated with the most modern technologies found anywhere in the country. Plus, he's back playing shortstop and managing his softball team. You know, Vanessa, Rich, who develops his own competitive team, says that he's found another good team, and it's right here at Southeastern Spine.
I draft a team that plays together, and I want to be part of a team that works together. And I saw that out of the Spine Institute.
Teamwork is an important part of what makes Southeastern Spine different than most of the other places that you will go to. And we want to remind everyone that no referral is necessary, even for a second opinion.
That's right, and as we've seen from George and Rich's stories, lots of people are willing to travel long distances to get a second opinion. But the good news is, when you come to Southeastern Spine, you're getting a lot more than a second point of view.
All the doctors at Southeastern Spine Institute work together. When you see a doctor at Southeastern Spine Institute, it's almost like you're getting multiple second opinions at the same time.
The Southeastern Spine Institute is independent of any hospital. So often, getting a second opinion here just makes someone feel better just about coming in.
I wanted a second opinion when it comes to the back, because I've had so many people say, you know, I wouldn't do the surgery, I wouldn't do this, but I've already had my mind made up. I prayed about it. And when I got there, that was it. Everybody was just so nice. It was just as I seen it on TV. I mean, the receptionist, everybody. And when I got there, I knew right then that's where I needed to be.
After suffering for over a year with back and leg pain, Hester Rodriguez from Hemingway, South Carolina, was not getting any better, and she knew that she needed a second opinion, and she was glad that she went to the Southeastern Spine Institute.
She did come here for another opinion. The pain she was having was becoming significantly limiting for her in terms of being able to do things that she wanted to do.
I would be in so much pain, popping pain pills, and I got to the point where I just really got tired of taking pills. I didn't know what was going on.
There are a lot of new technologies available to us now. It basically gets us away from using these medications that are just making everybody sleepy and tired.
Anything had to do with bending, I really couldn't do. Going to the food store, of course I had to cart, bend over. It hurt so bad. It was just miserable.
As many of you in pain know, it's important to have good people around you. Hester's lifelong friend, Margaret, was with her every step of the way, even though it wasn't always easy.
She was right there, and I was hurting, she was hurting. I had her crying, had her little blood pressure up because she was worried.
The pain was so bad that it got to where it was beginning to wear me out. So then I told her it was time for her to see someone else.
She had tried several non-operative treatments and unfortunately was continuing with her symptoms. It was interesting in discussing possible surgical options.
When it comes to surgical options, remember, one size does not fit all. The Southeastern Spine Institute has many different types of surgeons working together to come up with the best course of action for your specific problem.
It's really fortunate that we have all of the diagnostic tools available, as well as physicians in multiple different specialties such as pain management and rehab, as well as surgeons, so that we can offer patients the most appropriate treatment.
For Mrs. Rodriguez's problem, surgery is something that we know works very well. We had confidence that she had been looked at by all the right people. The decision was a smart one to make. Our minimally invasive techniques allowed her to get through the surgery fairly quickly and have a good outcome.
Southeastern Spine has a team of surgeons who perform minimally invasive surgeries and practice modern safety measures, including using neuromonitoring. Now, this is a technology that allows the surgeon to get real-time feedback from the patient's nerve roots and helps to protect the nerves during surgery.
The most important thing that we do as spinal surgeons is protect the nerves and the spinal cord.
Knowing that safety is Southeastern Spine's most important concern during surgery, it may not surprise you to know what Hester had to say about going into surgery. After all, she was confident that everything would all turn out fine.
I never looked forward to a surgery in my life, but that one I did. And it was just what I expected to be. I just feel good to be able to do everything that I couldn't do then, but I can do now.
Remember, when experiencing back or neck pain, it's important to find a place that specializes in the spine, but also to have people around you who care. It all helps in your return to a full life.
Yes, Margaret was always there for me and still is.
She got it together, and I'm just so relieved and happy for her.
Yeah, so Mrs. Rodriguez seems to be doing pretty well, and back to things she enjoys, and from what I understand, she's a pretty good dancer.
Go all the way. Hey! Hey!
It's so heartwarming to see people go from living in so much pain to being happy and dancing again.
It is. That's why she told us she wanted to be in the show, because she wanted others to know that there is help out there and there is no need to live in pain.
That's right, and in our next story, you'll learn that when you come in to get checked out, chances are you'll get better without surgery because there are so many options available.
You should at least hear what's available to you before you make up your mind about, going there or not, because if you do go there, I can guarantee you they're gonna offer you several choices, and it's probably not what you think.
Many times, people with debilitating pain think they need surgery to get better. In fact, they often come to a surgeon first. So when Will Henderson was examined by surgeon Stephen Paletti, he was pleasantly surprised Dr. Paletti gave him other options.
Dr. Paletti walked me through several options, and the options are everything from physical therapy to an injection, and they do try things first before surgeries. And that's the option we took, to try an injection first. And we were both very pleasantly surprised that that's all I needed.
Will looked for all the world like he would have surgery. His MRI scan showed that he had a disc problem that normally we would consider surgery for, but we thought we can try some non-operative care and maybe this will have a chance of helping him get better without having surgery.
At Southeastern Spine, they don't want to rush into surgery. Even surgeon Stephen Paletti chose to refer Will to other doctors in the practice to try one of the many other non-surgical options.
There's a lot of options. Come and see us and we'll kind of go through the list of things that are available. Now we have better injections than we've ever had before to get things under control. We have minimally invasive, different procedures that we can do to kind of open up stenotic areas and to take pressure off the nerves that don't involve a back surgery.
I was in severe pain and it looked like we were going to need surgery, and instead I got an injection that served the same purpose.
Sometimes they can go from a very debilitated situation almost overnight to feeling much, much better.
I mean, our goal certainly is to get patients to get up, get moving, be active, and do the things that you used to do.
It literally changes your life because you're not able to do the things you want to do, and then the technology and the knowledge they have, they can give you your life back.
Southeastern Spine created the Southeastern Studios to better inform you about back and neck pain, because the more you know, the less there is to fear.
It's nice to educate the public because some of them are scared. They're scared they come in, they're going to be told they have to have surgery right away, and there's a lot of options, there's a lot of things we can do. I think one reason why we like educated patients is the more they know, the less they'll be afraid.
Well, that's our show from Southeastern Studios. We hope that we have provided valuable information that you or someone you know can use to end terrible neck and back pain.
And as you've seen from our real patient stories, it's best to come in and simply get it checked out. Southeastern Spine has so many options, there is a good chance they can help you with your specific problem.
And remember, you don't need a doctor's referral. Make your own appointment. And as always, we leave you now with final thoughts of Southeastern Spine patients who were so happy they wanted to share their stories with you.
And be sure to join us next time, and just maybe we'll share your story.
Bye-bye.
That's one of the reasons why I would love to do this one, to do the interview, to help someone else that's going through what I have been through.
You're not going to get any relief going to those other places, but you need to call Southeastern Spine and let them see you. I talk about you guys all the time.
My chiropractor, who I dearly love and appreciate very much, first thing out of his mouth, this is Southeastern Spine Institute work.
Consulted with other doctors here in the Charleston area and also one up in Michigan, and decided that Dr. Anderson had the best solutions for what was wrong with me, and it turned out to be right. And it's nice to be right.
I knew without a doubt that everything they had set up to do, that I was going to come out of this just fine.
We hope you enjoyed the show. If you'd like to see any of our other shows on spine health, please go to southeasternspine.com and click Medical Documentaries. And to see if Southeastern Spine Institute may be able to help you or someone you know get out of back or neck pain, please call 866-SPINE-50. No referral is needed, and you can make your own appointment.